Hi, my name is Brooke Gillespie, and I'm going to be presenting today on common breastfeeding problems in women and how they are advised to deal with them. Before looking into the problems, it is important to understand the benefits of breastfeeding. According to the CDC, breastfeeding provides the best source of nutrition for infants, providing them with important antibodies that can help fight against short term and long term diseases. Breastfeeding also reduces the risk of some chronic diseases in mothers as well. Even though there are important benefits to breastfeeding, the prevalence of breastfeeding in infants declines as they grow older. According to the CDC, 84.1% of infants were breastfed at one point during the early stages of infancy. However, as they age to 1 year, the breastfeeding rate declines. It is also important to look at how many infants were breastfeeding at 6 months of age, because it's recommended that infants exclusively breastfeed until this age. However, only 25.6% of children breastfed throughout 6 months. There was a study conducted to look into why women were commonly stopping breastfeeding. Throughout this study, women were self reporting their breastfeeding status during follow up doctor's visits, and the results are quoted here by saying of 500 mothers who stopped breastfeeding completely before 6 months and provided a reason for discontinuing, the majority stopped within the first 6 weeks. The most common reasons cited were inconvenience or fatigue associated with breastfeeding and concerns about milk supply. To go along with what research found, it is important to understand that the common breastfeeding problems mothers deal with include, but are not limited to, low milk supply, oversupply of milk, engorgement, plugged ducts, fungal infections, and nursing strikes. A very common problem mothers deal with is low milk supply. The Office of Women's Health advises that breasts no longer feeling full after initial breastfeeding is normal. However, if the feeling continues, women are advised to nurse more often as well as offer both breasts to the baby to stimulate the milk supply. Another piece of advice is to allow the baby to decide themselves when they are full. On the opposite spectrum of low milk supply, some women deal with an oversupply of milk. The Office of Women's Health advises to rotate each breast when feeding when this occurs, burp the baby more often to have more room for milk, and to add a cold compress to when the breast feels sore. Branching off from over milk supply, some women experience engorgement, which results from milk buildup. It is normal for breasts to become larger, heavier, and a little more tender when they begin making milk. However, sometimes this fullness may turn into engorgement, when breasts feel very hard and painful. When this occurs, it is important to breastfeed often, pump more often to soften milk, and to support the breast when the woman is not breastfeeding. Women also deal with the problem of plugged ducts, which is when a milk duct becomes clogged and becomes very painful. The Office of Women's Health advises to continue breastfeeding to keep the flow through the ducts and to make sure to massage and support the sore spot in the breast as well. Along with problems within the breast, mothers can experience fungal infections on the breast. These are easily treated with antifungal medications. However, hygiene plays a prime role in preventing these types of painful infections. Along with problems within the breasts themselves, women's own babies can be a problem when it comes to nursing strikes. A nursing strike is when a baby has been breastfeeding well for months and then suddenly begins to refuse the breast. When this occurs, women are advised to keep offering their breast to their baby along with comforting their baby when trying to breastfeed by trying skin on skin contact and rocking. If striking continues, trying another method temporarily works, but to not give up on breastfeeding entirely is advised. Thank you.